from one of our tremendous sponsors and supporters of Vegas Unwrapped, Compassion Care Hospice. You've been hearing their commercials over the last couple of months. And joining us live in studio is Laurie. We don't give out last names. We protect the innocent. So unless you want to give out your last name and title.
That's completely fine.
Please speak loud into the mic and also so that the camera picks you up as well. But you are the executive director of the facility, yes?
Yes, I'm the executive director for Compassion Care Hospice.
There you go. And that means she's a muckety-muck, Mr. Cash.
Well, before we get into the muckety-muck,
Okay.
Laurie, tell us a little bit about yourself.
Absolutely.
Tell us how you got to where you are today in, about 30 seconds. No, take your time, but seriously, tell us who you are and how you got here.
I've been in the Las Vegas area for about 5 years now. I started out as a marketer, actually, for Compassion Care Hospice, and then was promoted to Director of Business Development, and over the last year, I've been Executive Director for Compassion Care Hospice.
So in total, you've been with them how long?
5 years.
Wow. Now, what was the market like in Las Vegas 5 years ago in comparison to today? Because I got to imagine your biggest competitor, so to speak, is Nathan Adelson Hospice Center. And I know there's smaller ones around, but I got to imagine they're your largest competitor.
They're one of them. There's 30 plus hospices in the valley, so we're all out there to provide a service, and we just want to provide care for the patients that have been diagnosed with life-limiting illnesses.
Mm-hmm.
And there's such a need for it. It's not to be trite about it, right? But it's not about competing to see who. You want to have as much out there as you can so that there are choices and that people will have someplace to go to, as opposed to, being alone or wherever it might be. It's a wonderful thing to have hospice.
Definitely, and one fit for us might be different for another hospice, so we definitely want the patients to have a choice out there and be able to see which hospice is the best fit for them.
It's a good point, especially, let me ask you this. I mean, most people think about hospice, they think about, the elderly, of course, senior citizens and the like. What percentage of your group that comes in fall into that category, and how young are some of the people that also have to use this type of service?
For the most part, the percentage of patients we have on service are the elderly, 65 and older. We do not do pediatric at all, so anybody 18 or older. We do, on occasion, you're seeing more cancers and so forth in the 40, 50-year-old population, so we do definitely have that age group as well.
No question about it.
Now, we have a friend of ours, let me backtrack. What would you say is the ratio of somebody who enters hospice care for whatever length of time and actually successfully graduates from hospice care to go back to some sort of quality of life? What's the success ratio, would you say?
There's definitely times where people will come on service and there's certification periods.
Mm-hmm.
So after the 6-month period, then we're certifying them every 60 days, and there's medical criteria they have to meet in order to stay on hospice. So there's definitely those patients that do not show decline and stabilize, that do come off the service, but
mm-hmm.
then as their disease progresses later on, they can always come back on service.
And I want to clarify that the hospice services that Compassion Care provides is home-based.
Yes.
This is not a facility that someone would come to for hospice care. You're sending your crisis team to the homes.
Yes, hospice is a concept of care. It's not a place that you go. It's definitely, you can get our services in your own private home, in an assisted living, a nursing home, a group home. We have patients in the hospital that are extubation patients that are coming off of life support, and we'll take care of them right there in the hospital and get them stabilized before we bring them to their own private homes. So it's definitely, hospice services can be provided anywhere they call home.
All right, so I'm going to be more specific with your question then. Have you ever had anybody in hospice care who was terminal that absolutely turned it around and walked away from it?
That has been diagnosed with a terminal illness?
Terminal illness with, a week, 2 weeks, whatever the number is, and 2 weeks later gets up and walks out the door. Or is able for you not to service him in his home anymore. You ever had that?
Definitely, if their disease if their disease process isn't progressing and they're not meeting medical criteria anymore, then they're discharged off the service.
Okay.
And there's nothing wrong with that because
Nothing wrong with that.
That's good news. So they'll go off service, and if they have a reoccurrence or their disease progresses to the point where they're eligible again, then they can come back on service.
Part of the reason we asked the question is we know somebody who's a friend of ours who's absolutely done that. But I wanted to bring that out, Aaron, as a statement to the public so that they don't think that hospice care is the end. Because it may not necessarily be so. We know it from Jimmy. Now
Right.
we're hearing it from Laurie from
Right.
a different perspective. And I think that's important because, hospice has this with all
Connotation.
It has the death sentence connotation
Right.
of it. And it's nice to know that people can, stop the process.
Right.
Great.
Definitely.
And I think what's really a nice feature of what Compassion Care offers is that they do it in the environment of the person who needs the service. You have someone who's trying to live comfortably and they're at home and they're in surroundings that are familiar. They're with family. They're in that much more comfortable setting than rather than the sterile environment of a hospital. I mean, I know you service people in the hospital, but you're not necessarily having to provide that. You go to where the people are comfortable, and that's important.
Absolutely. I really truly feel that patients and their families are more comfortable in their own surroundings.
Right.
They can enjoy whatever time they have left. They can heal and, take care of themselves right in the comforts of their own home.
Absolutely.
So
And that's important. I think that's great for the mindset. I want to clarify because when you opened, you used the terminology life-limiting illness in terms of what hospice provides.
Yes.
Let's clarify exactly what that means, what area of I want to say illnesses, so to speak, that this covers. Let's clarify what the symptoms are or the type of medical situations that would, dare I say, qualify for life-limiting illnesses.
Life-limiting illnesses, a physician will determine that, so you'll need a physician's order stating that you have a life-limiting illness. And it's not just cancer patients anymore. Now we've got patients on service for dementia, Alzheimer's, end-stage liver disease, kidney disease, Parkinson's, anything that is limiting, any disease that the doctor feels is life-limiting.
Right.
They're not able to do the things that they used to be able to.
Like AIDS, stroke,
AIDS,
all of that
stroke,
stuff.
all of that.
Okay.
Heart, CVA.
And also, too, it could be somebody who maybe has multiple symptoms, not just falling into classification of one of these. You could have, God forbid, a couple of these.
You could have several comorbidities. You
Right.
could have one diagnosis of congestive heart failure
Mm-hmm.
and then still have, a pulmonary lung disease or liver disease or something else and have a collection of, comorbidities. And all of those collectively could be considered life-limiting.
Right. Interesting.
Yeah, it really is. And again, because most people, and that's why it was so important to get you on the air. I mean, the commercial is great, and we appreciate it, and we love the advertising, but it's so important for the public to understand what this is, because, again, I would say if you stopped 8 out of 10 people on the street, they wouldn't know.
Yeah, a lot of times we'll go into people's homes or when doctors have written the orders and we'll go meet with the patients and families. It is. They hear the word hospice and it's worse than a bad word.
Yeah.
So it is nice to educate the community.
All right, what I'd like to do is step aside for a quick break, okay? What I'd like to do is throw some hospice misconceptions out to you,
Okay.
and let's combat those.
Okay.
Let's get rid of those misconceptions, which I think is a nice segue to what you were just talking about.
Absolutely.
You're listening to Laurie. She's the executive director from Compassion Care Hospice here in Las Vegas, one of the proud supporters and advertisers, and we're proud of having her at Vegas Unwrapped. You're listening to us here on Vegas All Net Radio. Phillips and Cash, Mr. Bobcat on the board. Don't go anywhere. We'll be right back.
Claire?